Hello, my name is Zach Wasson. I'm going to be taking us through some of the different views of a CT head and neck exam and pointing out some of the anatomy that we can see there, and then comparing that to a couple of X-ray images or an X-ray image, and then a couple of MRI images as well, and explaining kind of the difference between those and what can be seen and what can't be seen, and what is better for different anatomical structures. So we're going to start here with the reconstructed CT. This is a sagittal view. I just want to start up here at the top, go down here. You can see it's the nasal. If I go right in the middle of the nasal septum into the nasal cavity, and let me see if I can see. Yeah, here's maxillary sinus on the right and maxillary sinus on the left, and then you can see some of the. It's better to see it on the coronal view, but um, yeah, there's nasal cavities is how essentially how air comes through, gets filtered before it goes into your respiratory system. So here's a good view down coming from the nasal septum, uh, the nasal area, right into here's your oral cavity. You can see the hard palate here. That's bone. You can see because of the attenuation of the photons. Obviously, there's a high attenuating bone in a CT image, and then the soft palate here on the back. You can see the tongue, obviously, in the base of the tongue, genoglossus muscles here, maxilla, mandible. It's difficult to see them now because we're in a sagittal view, but we'll get to it when we see the axial view. Here's the epiglottis right here, separates. Function of this separates the trachea from the esophagus, so you're not swallowing air and you're not, food doesn't go down your trachea. So the pharynx is kind of set up into three parts. You get the nasopharynx here up near the nasal cavity, the oropharynx right here, right behind the oral cavity, and then the laryngopharynx down here near the larynx. Larynx is here, surrounded right here with the. This is the hyoid bone, very important. You can see it on almost every single imaging modality we'll see today. And then some of the thyroid cartilages here as well. Not going to really get into all of that because it's difficult to see here on the CT, but just wanted to point out that hyoid bone because it can be seen in like every imaging modality. And then as you move further down, you can see this air here, the trachea. Obviously, we know that photons are not going to get absorbed or attenuated through air, so that's why it's just dark. Same thing with the sinuses up here, it's just air. Okay, I'm going to move on to the axial view. Go up here, we've got the brain, eyes, and then as we can see the nose here, and you can see this nasal septum come right through. That's a bone right in the middle of your nose. You can feel it. Um, and as I said earlier, you can see these two maxillary sinuses, and then you can kind of see where the nasal concha are going to be, your sinuses in the middle. We'll see that on the coronal view. And as we move down, we've got you can see the maxilla here, and then the mandible. And it looks like almost we may have some metal in the mouth because of these artifacts. Just learned about that in our CT class or imaging class. That we might have some artifacts here on this CT image. But that's okay. As we move down, we can actually see some of the portions of the tongue here on this axial view that we couldn't see before, where these are like the genioglossus muscles and the sublingual some lingual glands here at the bottom right here at the bottom of the mandible, and then also submandibular glands. These are the glands that are actually going to give your mouth saliva, being able to break down those starches that we've talked about before. And as you can see, a lot of these circles here, like what are those? Those are actually the um, cardiovascular supply going up to the brain. This is right through the neck. It's very, very important. Obviously, external, internal carotid. Your jugular vein is really large. That's going to coming down from the brain. Those are very important. And as you can see, might be a contrast agent in here as well because of how white that is. And contrast agents used to attenuate photons, just like a high attenuating material would, like a bone. So we can see angiography. You can see how those vessels are actually moving blood through. And as we go further down, we actually here's the hyoid bone once again, very high attenuating bone there. And then you can see as you keep going down, trachea obviously full of air as well. And then we can down there's the lungs, and as we can see, some of the spinous process of the of different vertebrae keep showing up. So there's a gap, and then another one, and then a gap, and then another one, and a gap, and another one, as you move down there. So I think that's all I wanted to show here in the axial view. I'll go to the coronal view just to show a couple of things here. I think it's important to see. As you can see, we've shown before these maxillary sinuses are on the right and the left side of the nose. Those are the ones that will get very infected when you have when you have a sinus infection, and it can really hurt and feel very heavy. Here's like the inferior nasal concha, middle nasal concha, superior nasal concha. Those are also the sinuses that they filter the air before they go down to your respiratory system and into your lungs. You can also see a portion of the trachea, obviously, again, trachea up through and down to the lungs. And then towards the back, we can see, oh, that's a great view of the vertebrae there. We've got a C1, C2, C3, all the way down to C7. It's a great view there of the vertebrae. Now I'm going to move over to some MR images as well. MR does a great job of differentiating bone and soft tissue and can really see the intricacies that CT images really can't. So we're looking at the nasal septum here again, but it looks kind of the contrast is a little bit less, but you can see better resolution in some of these structures. So as you can see, we were talking about the carotid arteries that supply blood to the brain. Here's those two right there. As we go down, obviously we can see the teeth look a little bit different here in the MR image. And then again, that's as far as it goes down. I wish if we can get a little bit lower, we could show a little bit more. But obviously, you can see the spinal cord here as well. Spinal cord going down. Yeah, I just think it's important to show the difference between some of these MR images and what they're supposed to display, and the differences in that in the CT image. I'm going to move us over now to an X-ray image. Maybe. Yep, there we are. To show the same thing here, we can see the hyoid bone. Obviously, we can see that in every single imaging modality. And then C1, C2, C3, C4, C5, C7. So there's the seven cervical vertebrae. These are the spinous processes. You can see kind of the transverse processes, but here's an X-ray image of the face and neck, maxilla, mandible, obviously. You can see even the trachea there as we know. And all of these imaging modalities, that trachea is going to be filled with air, so it's not going to attenuate the photons like the bone will. Um, and in terms of dose you're receiving from each of these, obviously the MRI is going to give you no dose. That's a magnetic resonance imaging, so you're not getting any ionizing radiation to the body like you are for CT. CT is going to give you the most dose out of these three that we've talked about. Let me go back and show you the CT images as they can be reconstructed. They're giving you the most dose on the level of maybe milligray for head and neck CT, maybe a couple of milligray for your effective dose, whereas you're not getting near as much that when you get an X-ray of the face. Yeah, it just depends on what you're looking for. Vasculature might be best displayed on a CT image, but soft tissue of the head and neck might be best displayed on an MRI image. Just it depends on what you're looking for. So, just wanted to point out a couple of the anatomical landmarks of the face and the neck, including things of the respiratory system. So, that's all I've got for us. Thank you very much.